All right. Well, Joan, thank you so much for having me. My name is Michelle Johansson. I am the program and volunteer coordinator for the NAMI Billings affiliate in Montana. I've been doing this for close to 2 years now, but I've been part of NAMI Billings for going on 7 years now. A quick tidbit about me, I moved in Billings, Montana in 2017, joined NAMI Billings for the personal support groups that they provide, and quickly became involved, quickly became a facilitator for that support group. I am now a state trainer to train future facilitators. I'm also trained in multiple programs that I will go over here in just a few, but I have personally been impacted by mental health. I've been through quite a journey. I'm proud to say that I live in recovery, which means to me that I have a healthy balance between my mental health, my physical health, and I have a support system that gets me through the good, the bad, and the ugly. So that's just a short brief about me. As NAMI Billings, we've been an affiliate since 1996. We've moved around a couple times, but we're very happy with where we are now, and we've evolved over the years. We started as just a single support group for the family members who have loved ones that were struggling with their mental health and needed some community and support on that journey. We currently have two specific support groups. These are available in person and online via Zoom. The first one is Family Support Group, what we started with. They meet on Tuesdays at 6:30 p.m. every week, with the exception of any major holidays. But it's a great group for the family members and the caretakers to get together and really talk about the struggles that they have trying to find help and support for their loved ones. Uh, the second group is going to be the NAMI Connection support group, which is for the individual with a diagnosis. They meet Thursdays at 1 o'clock and then every other Saturday also at 1 o'clock. This is also available on Zoom. If any of you wanted those support group links for Zoom, shoot me an email. I'll make sure to put my email in the chat so you have that. But the connection support group, again, for the person with a diagnosis to come in and talk about the here and now, what's going on, where they need support, maybe some resources, and ultimately encouragement to keep going. The beauty of both of these groups is that it's not a therapy session because it's not led by a therapist or a doctor or a professional, really. It's led by two trained individuals who have personal experience in this field and have been thoroughly trained to facilitate the group. So I use myself as an example. I attended the support group for about a year and a half until I was trained to facilitate it. So, we're not there to give professional advice or tell them what kind of medication they need to be on, but truly just to lead the group into an open table conversation about what's going on in each other's world and how we can support, encourage each other, and maybe guide each other to different resources in the community. Aside from our support groups, we offer seasonal classes on mental health. Uh, and they kind of mirror the support groups in the sense that we have one called Family to Family. And as you can assume, that's for the family member. And then the other one is peer to peer for the individual with a diagnosis. Both of these classes are 8 weeks long, where they meet once a week and they go over all the information they need as far as the diagnoses that are out there, treatment options, uh, learning how to advocate for yourself or advocate for your loved one, how to have those tough conversations when you're struggling to communicate with each other and figure out what uh, each other needs in this journey. And then at the end of the class, they receive a certificate of completion as well as the binder full of information that they went through over that entire class. And this is available for them to take home so that they can refer back to it in the future. It's got some really great resources in there. And keep in mind these support groups and these classes are free. Everything that we do is free to the community. We never charge for anything. It's a wonderful setup. It's a great way for people to come together and find support. And then finally is what we do, what I do primarily along with my program advisor is we do community presentations. So many presentations like this, we go out to really wherever the community invites us. We've done everything from our local mental health center to hospitals to schools. And we did the Bureau of Land Management one day, and we talked to a couple different apartment residents that just reached out to us and want information on what's available. But we love to share what we have to offer because we find that we're the best kept secret in town. And when people Google us or Google support group, we're the first thing that comes up, fortunately. So that's how a lot of our attendees have found us. Another presentation that we do is called In Our Own. This is something that I've been trained in as well, where conditions present their story and in the style that they talk about what happened when they received their diagnosis, what helped them through their journey of recovery, and then what's next for them. And that's usually a step of advocacy into the community and giving back and supporting others going through their journey. A class that we have that I forgot to mention was Provider. This is a 4-hour seminar where it's a panel of a family member, a person in recovery, and a mental health professional who discuss what it's like to deal with the mental health journey and how collaborating with providers and having a mental health team benefits the person as a whole. So not just the individual with a diagnosis, but the family member supporting them. It's a great seminar. We usually do it in a 4-hour segment, very powerful, very interactive, and excellent information. The last thing I want to say that we do and offer here at NAMI Billings is that we have started a program just last year in May called NAMI Billings Outreach, where I have 2 volunteers visiting our local psych center every Wednesday evening during visitation hours to talk to the family members, but also to talk to the patients that are in crisis and having a difficult time, because we found that here there is a huge gap in care between when they leave the psych center and when they see a doctor, a therapist, or a psychiatrist again. So to let them know that we have a support group, we have a community available free and available to you on a weekly basis to kind of get you through that next step of leaving the psych center and just something to look forward to every week to keep you going. It's done had a great outcome of people attending, and we've been doing that for gosh 8 months now, so we're very proud of that program. That's a lot of information. I talk pretty fast, but that's the gist of what we're currently doing here in NAMI Billings. We're very proud of our work and what we're doing. uh, uh, I'll leave it at that. Does anybody have any questions? At the moment, no. All the classes are in person. The only time we had it virtually was back in 2020 when the pandemic hit us and we couldn't meet in person. So we were able to do it online. Wasn't ideal, but we made it happen. Uh, there is one class, if you were to go on to NAMI.org, there's a class called NAMI Basics on Demand. And I apologize because I didn't mention this class, but it's a class for parents with young adolescent children struggling with their mental health. We would love to have that in person. We haven't been able to in a while, so we refer people to uh, opt to the option of doing the NAMI Basics on Demand, where they can do it at their own pace in the comfort of their own home. So that would be one class that's available virtually. Oh, sorry, I'm cutting out a lot. Yeah, we are Billings is the most east affiliate,
Mm.
and you'll have to correct me if I'm wrong. Their Miles City, I believe, is a little east of us.
Yes.
I am not from Montana, so you'll have to correct me if I'm wrong. And I know that they were uh, attempting to start an affiliate, but I have not heard from them for about a year, so I don't know how that process is going.